Welcome, Dr. Tristan Guevara. How are you doing today?
Great, thank you.
Good, good. Could you just share with us a little bit of your background?
Sure. I actually grew up in Grosse Pointe, Michigan. I went to the University of Michigan for undergrad.
Nice.
And then went up and went cross sides, went to Michigan State for med school. And then eventually completed my residency at Providence Hospital.
Okay.
And have now been in practice for 15 years at an organization called Silver Pine Medical Group, in which we have offices in Sterling Heights, Macomb, Shelby, Chesterfield, in those areas.
Okay, sounds good. Thank you so much.
No problem.
So we keep seeing urgent care centers opening up around town. Does this mean that we are choosing urgent care centers more over emergency rooms?
That's a great question. Actually, there's a lot of urgent cares that are coming in every city right now, and it's probably more reflective of the fact that most people are working harder. People are working longer hours, and so it's tougher and tougher to get to their family doctor. The family doc that stays open late, that has late hours, those hours are really sought after. So those docs are busier in those hours. Urgent cares try to help those patients for urgent care needs during the day and after hours. And so that's probably why you see more of that than more just ERs kind of popping up.
So would you say a patient has the right to choose an urgent care center over an emergency room?
Yes, and actually sometimes they do it right and sometimes they do it wrong.
For example, if they do it right, what does that consist of?
So the reality is when you go to an urgent care, typically what the key things you want to actually have treated would be like if you had a easy infection, for example, a urinary tract infection, a sinus infection, or you cut yourself. Like those are easy things that can get kind of quick care. However, when you're going to the emergency room, you're considering the emergency room, the things you have to think about is this life-threatening?
Okay.
Is this something that's bigger that you have to be careful for? And there's many other conditions that would kind of lead you down that path.
Like what type of conditions?
So a classic one is, and people do this sometimes to our urgent care, they'll go in thinking that, okay, I'm having some chest pain, I want to come in and take a look at this. You know, and an urgent care can do a lot of things, but mostly they're going to do an EKG and kind of assess. Whereas an ER can really make sure and rule out a heart attack. So the chest pain, I would never go to an urgent care. If you're having severe shortness of breath and you don't know what's going on, you go to the ER. Anything else that you feel that this person is going to be most likely admitted, you don't want to go there because they're most likely going to end up sending you anyways.
Okay.
So that's what I would do.
Okay, sounds good, thank you. So are there any benefits in waiting to see a family doctor if the patient has not gone or has gone to the urgent care center and to the emergency room? Would it benefit them to wait to see the family doctor?
And that's also a great question. You know, I am a family practice doctor as well. So being a family doctor, I like to see my patients if I can. Okay. And what we always want to honor, you know, having urgent care is honor that relationship that a patient has with their own doctor. They know the patient the best. So they have the best continuity of care. They know how to take care of them. So that's the best way to do it. So if you can wait to see your doctor, go see your doctor. If you have something that's going on that night that needs to be seen, then you need to come into the urgent care and we can kind of assess it for you.
So what's the best advice that you could give to a patient if they were considering going to an urgent care versus their family doctor?
So what I would really focus in on with that is just to make sure, number one, look at the urgency. How urgent does this need to be treated? If this is really urgent, for example, you have a really bad urinary tract infection, you're not going to wait till the next day because you're going to be in a lot of discomfort. That's an easy reason to go see an urgent care. If this is high blood pressure, your blood pressure is just a little bit elevated and you're a little concerned, call the next morning, get in with your doc so they can address it because they know what medicines you've been on, how best to treat you, and to have better continuity. If it's something that you feel that this is new, this is life-threatening, you were in a car accident, you were actually having chest pain, any chest pain, you go to the emergency room that night. That's the best way. A lot of times patients also kind of determine where to go based on finances. And that's one of the key things that drives them where to go. So sometimes going to the urgent care is cheaper than going to the ER. Likewise,
that deductible that some patients have to pay.
yeah, and
Correct.
so likewise, going to the family doctor is cheaper than going to the urgent care.
Right.
So when you can, sometimes it's more cost effective to go see your own family doc.
Okay. So some of the more simple sinusitis, cold viruses type issues, perhaps go to the urgent care first, and more life-threatening, go to the emergency room or see your
family doc.
doctor.
For example, like even the flu, and this was a big flu season this year. We have the ability to do a flu test within 10 minutes to tell you if you have the flu, and we can treat that within the first 72 hours. That's something that's simple and easy for an urgent care, but to go to the ER for that, you'll wait hours to see that for just that simple test. So that's a good example where you can just kind of sneak into the urgent care.
So does the urgent care also take care of maybe strep throat or anything like that?
Yeah, we can diagnose strep, mono, flu, urinary tract infections, sinus infections, pneumonia. We have x-rays at all of our urgent cares, so to further make sure that's fine. And also fracture care. Now that it's summer, kids love to go be in their sports.
Absolutely.
And so unfortunately, sometimes they get injured, so coming in to rule out a fracture is an easy thing we can do there.
Well, that was some great advice, and we really appreciate it.
Oh, no problem.
And thank you so much for coming in and talking with us today.
Thank you.
Thank you.
For more information, visit mclaren.org/Macomb Urgent Care.